Regarding chemotherapy, it induces apoptosis. It always challenges the target cells, rapidly dividing cells instead of only the target cells. So that lacks specificity and can cause gut problems, bone marrow hypoplasia, hair problems, and skin problems. Uh, it helps to eliminate micrometastasis, especially in the lung. It is indicated in osteosarcoma, Ewing sarcoma, and metastatic bone tumors. It is given 6 to 12 pre-op as a neoadjuvant and 6 to 12 month post-operatively. The agent-specific side effects we have to remember is doxorubicin, which can cause cardiac toxicity, isofosfamide, which causes neurological toxicity, cyclophosphamide, which is myelosuppressive and neurotoxic, and bleomycin, which causes pulmonary fibrosis. Regarding the radiation, it produces free radicals leading to direct genetic damage. It is mostly indicated in the soft tissue sarcomas and Ewing sarcoma, lymphomas, and multiple myelomas, as well as some metastatic disease, specifically the bone and prostate tumors. The tumors which are radio-resistant are renal and GI mets. Complications delay bone healing, infection, sarcoma formation, secondary sarcoma formation, avascular necrosis, and growth arrest.